Cameron, and this is The Conduit. All right, everyone, how are you doing? You already know what time it is. It's Monday, so it must be my favorite day. All right, that's when everything gets started. I love Mondays. Businesses are open, schools back in session, all those good things. You can really make forward progress. We love that. Looks like we're live now on YouTube. And don't forget to subscribe, like, and share. We've got a great conversation for you today. And so we're going to jump right into it. I'm going to introduce my guest and bring her up. And we've got a presentation for you today that I think is very tremendously important. As many of you follow me, you know that I'm going through some health issues right now, and I kind of share those stories with you. And so it's definitely important to me also. It affects me, right? So without any further ado, I'm going to bring to you Susan Young. Susan, how are you?
I am doing just great, Marwan. How are you today?
Well, I am blessed and highly favored. I'm so glad that you can join us today for an exciting and informative conversation.
Thank you. This has been a long time in the works, and I'm glad that we were able to finally get a time when we could get together.
Absolutely, absolutely. So let's start off with learning a little bit about who you are. Who is Susan Young?
Well, okay. I am someone who has been involved in K-12 education all of my adult life, and so I've always been concerned about healthcare as it relates to my students that I've worked with and the impacts on them and how important it is for everyone to live in a healthy environment. And when I moved to Washington in 2004 and was living on one of the San Juan Islands, on Lopez Island, on a farm, I began to fully appreciate, because of the limitations of living on a ferry-dependent island, I began to appreciate some of the limitations of that kind of access to healthcare. And I started paying more attention to what I did and did not have readily available to me while living on Lopez. And then when I moved to Bremerton in 2016, I thought, wow, this is going to be so awesome. I've got access to Seattle. I'm going to be able to go get all the healthcare I want anytime I want. And there's a hospital in Bremerton and life's going to be perfect and good. And when I got here, I found out that that wasn't exactly the case. And I started learning about the mergers that were beginning to happen in healthcare as a result of actually consolidation that was being encouraged through the healthcare initiatives that were happening in 2010, 2011. And so, although I still at that point in time had my own business, by that time, I was no longer in the classroom. I was no longer a school administrator. I had my own consulting business, which I still have today. And so I had a lot more freedom in terms of my time and where I could put some of my energies. I started learning more about the healthcare system, and that was how I got involved in what I'm going to share with you today and what I'm doing today. Aside from that, I've got a couple of grown kids who are still down in Southern California, and a delightful granddaughter, and tons and tons and tons of lovely people up here in Bremerton who I really am blessed to be able to spend time with and get to know. So that's kind of me.
That's awesome. So tell me, what do you like to do for fun?
I like to do a whole wide variety of things. Yesterday afternoon, I spent my afternoon at Ridgeline Brewery, not drinking. I was there for a block printing workshop.
Oh,
that was being offered by Elise, who's with the Joyful Plant. And I love block printing. I also enjoy Zen tangling, which is kind of a meditative way to draw in ink, which is
mm,
kind of fun. I live very close to the Roxy. I'll go to Facebook, put up a message. I'm going to the Roxy. Who wants to come with me? I never know who's going to show up. Somebody almost always does. Sometimes it's one person. Sometimes it's 15. Never know. But I like doing that, and I love getting out, walking, and just kind of hanging out in Bremerton.
nice, nice. I didn't know that you were so close until I read your public comment that you made to city council. It's like I live downtown. It's like, oh, Susan lives downtown. Okay.
Yeah.
Cool. Have you had the special tour of the Rockies? You've been able to go up and look where the film is actually projected in the back?
I have not. I've gotten kind of the floor plan tour, but I've not actually been up in the projection area. I'd love to do that. Now that I know, I'm going to ask Michael when I can go.
Yes, if you get a chance, you need to do it. It is super awesome in there.
That's great. Yeah, I will do that.
Well, let's jump into your presentation here. Today is healthcare in Kitsap County, today's landscape. And just let me know when you want me to forward the slide.
Sure. Okay, great. Thanks. I will. So the point of talking with you and sharing with everybody today is to give you an overview of what the current state of healthcare is in Kitsap County. I've been very interested in learning that I've done some door knocking in the past to talk with people about healthcare and what they perceive as being what's happening here in Kitsap.
Mhm.
And I'm often surprised that people, because they've been in good health, are not aware of a lot of the limitations that we're living with here in the county. And so, what I would like to do is, I would like to educate people about the situation before they find themselves in the emergency room or before they find themselves being referred for some kind of serious treatment, so that they have a better chance of navigating the system as successfully as they possibly can. And a lot of this in Kitsap County definitely has to do with the impact of system mergers on healthcare availability and the quality of the healthcare that's actually available. So, what I'd like to do, in addition to just kind of talking about the general situation, is also mention some recent legislation that's been passed that has been designed to help improve the situation here, but then also talk with your listeners about the kinds of things that they can do, because it's going to take all of us to be able to get back to the point where we have access to healthcare that is affordable, that's comprehensive, and equitable. Because right now we don't have that. So let's go to
Absolutely.
the next slide.
All right. And as we forward the slide, if you do have any questions for Susan, please go ahead and put those in the chat, and we will give them to Susan to answer.
Great. Yes. So research has definitely shown over the years that hospital market concentration or mergers has a really negative impact on patients. Some of these impacts include higher cost and reduced access to services. And in many areas, a single system treats the majority of patients, which then creates a monopoly that limits patient choice and competition. And right now, that's the situation that we are in Kitsap County. We have one hospital, and that one hospital is owned and operated by a system that also controls access to much of the primary care and specialty care that's available to us. Next.
Now, Susan, how did this happen? How did this become a proverbial monopoly?
Well, what happened was back in 2012, 2013, there was a merger that took place between what at that point in time was, I think it was just Franciscan, and it became CHI Franciscan when it merged with Harrison Hospital. And there's something, we're not going to get deeply into this today because this is like years of doctoral work.
Mm-hmm.
But there's something called Certificate of Need, and it's an office that's operated by the State Department of Health. They decide how many hospital beds any given area can have. And what happened in the process of this merger between Franciscan and Harrison Hospital was the hospital beds allocated to Kitsap County came under the control of one single entity. That's what created the horizontal monopoly. And then as that happened, the primary care physicians and other specialists were also strongly encouraged to join into this system and become employees of the system rather than having their own independent practices. So that's how you get the vertical monopolies, which is what they're called. And it's very, very commonplace. Anytime you get a merger, you start to see that kind of thing happen.
Hearing that, Susan, it makes me feel like, even more important to make sure that, our point in time count for our unhoused individuals is we get as accurate a count as possible, because, the more people that we're counting, the more beds, hopefully, that we have. So when the census comes around, and I know a lot of us don't like to fill out the census, we don't want to answer the door, but that is tremendously important.
Yeah, it really is, for so many different reasons. And the thing, to not like be too repetitive, but this is something that is so important that I am going to say again and stress that healthcare system mergers almost always end up resulting in higher costs to patients. For example, St. Michael is one of, if not the most expensive healthcare systems in our entire state. In addition, there is a reduction of services, and anybody in the county who's needed to get to a dermatologist in recent memory can attest to that. And part of that issue is that in a subsequent merger, when what had become CHI Franciscan then also merged with Virginia Mason, the decision was made by hospital administration that they didn't need to have a dermatology department here because there was one over in Seattle, which is fine if you're in Seattle. But if you're not, anybody who lives here recognizes that it's a lot easier to say, oh, just go to Seattle, than it is to actually make that happen. So now if you need a dermatologist and you're in that system and you live in Kitsap County, it's going to be difficult to get the kind of care that you need. And then also there are now research is showing that there is also a detrimental impact on the quality of the healthcare that people are getting. So it's less services, and you can't necessarily depend on the quality of the healthcare being what it ought to be. So we are seeing these kinds of impacts happening, not just here in Kitsap County, but throughout the state and across the country. So let's go to the next slide.
All right.
Okay, we have another layer, particularly in Washington State, that makes our situation even a bit more, not a bit more, a lot more concerning. And that's the dominance of Catholic healthcare systems in Washington, which has become a growing concern. And I'll explain why. It's because there are currently there's 9 hospital systems in our state altogether. 3 of the 9, so 1/3, are owned and operated by Catholic healthcare systems. In fact, right now, between 48 and 52% of all hospital beds in our state are owned and operated or under the care of a Catholic healthcare system. Why is that something that we need to note? It's because this concentration of power really ends up limiting patient choice. It limits competition, and it raises concern about a document, because of a document that is called the Ethical and Religious Directives of the U.S. Conference of Bishops. In Washington, our state has one of the smallest number of practicing Roman Catholics in the country. So when 50% approximately of our hospital beds are being controlled by a religious organization, and when that religious organization is predicating the kind of healthcare that it offers based upon its religious doctrine, that becomes problematic. And I would have a problem. It's not that I have a problem with religion. I would have a problem with any ideology being forced onto patients in any healthcare system if there is no opportunity for people who don't subscribe to that ideology to have an alternative for their healthcare. That's,
Absolutely.
yeah.
Absolutely. We have our first question coming in from Justin Gurley. How are you helping bring a single payer system insurance to Washington State?
Okay, that is something that some groups that I've helped found are working with. And we are engaged with a variety of groups: Washington Physicians for Social Responsibility, Healthcare is a Human Right. And it's not something I'm going to talk about a whole lot today, but at the end, I am going to be providing an email address. And at that point in time, if Justin would like to learn more specifically about that, that person can reach out to me, and I would be happy to help them learn more about that, because that is potentially part of the solution.
Awesome. And Justin, I'll put her information up. Can you explain single payer really quickly? Just what is that for folks that
Well,
may?
it's a system that's more similar to what's happening in Great Britain or in Canada, where rather than having all these different private health insurance companies paying for people's treatment, you have a national system that's a lot more like Medicare or Medicaid, where pricing is controlled. People go through one insurance company. In Portugal, for example, they do single payer, but then they also do like we do with Medicare, where you can get supplemental insurance, and that's through private companies. And I don't know where we would end up with that, but what we're really looking at with my organization, while single payer is a piece of that, it's not our major area of focus, but we
Okay.
support it where we can, and wherever we can. So is that good enough for now?
Yeah, absolutely. Thank you.
Okay, perfect. So and single payer plan also comes into this, in that if we solve the problem of private insurance monopolies, that may be single payer may be a way to do that. Because I am assuming that at that point in time, we could not rely on any one provider who was going to limit healthcare in any way in that manner, if that makes sense. So let's go to the next slide, because I'll explain a little bit more about the monopolies and and what's happening here right now. And then I'm going to go back to the ethical and religious directives on the next slide and talk a little bit more about that, so people get a clear picture of why this is such a concern.
Okay.
So right now in Kitsap County, 100% of all of our hospital beds are controlled by an organization that's now known as Virginia Mason Franciscan Health, which is also VMFH. A lot of people still refer to it as CHI, but CHI has been subsumed, at least here, by Virginia Mason Franciscan Health. And it's important to understand that Virginia Mason Franciscan Health is part of a larger organization that also owns anything with Franciscan in it. It also, in other states around the country, anything with the name Dignity in it. And it's a company based in Chicago. It's called Common Spirit. It is the largest Catholic healthcare system in the country. And it is the second largest healthcare system in the country the last time I checked. And so we're in a system that's being controlled by somebody in Chicago who has absolutely no idea about us, what it's like in the Pacific Northwest, what our particular concerns and needs are. And that is problematic. And then, as I mentioned, many of the local providers in terms of primary care, specialties, day surgery, all those kinds of things have been folded into the VMFH system. So those physicians and those other providers are no longer in independent practices. They are contracted employees with Virginia Mason Franciscan Health, which means they have to follow all of their regulations. So you've got what they're now calling a horizontal monopoly, which is the hospital.
Mm-hmm.
But then while you're in the hospital, when a physician, a hospitalist, or somebody says, well, you know, I'm going to give you a referral to go see an internist when you get discharged, they're going to refer you to an internist who is an employee of the same company. They're not going to refer you out.
Well, Susan, how does this happen? Don't we have protections against, these types of things happening?
Well, we think we do. But what I've been told by the Attorney General's office is that the current antitrust law is so outdated that they are no longer able to apply it in situations like this to the degree that they need to. And additionally, most of these big hospital organizations have figured out how to circumvent those times when they might, the Attorney General might be able to apply antitrust law. They figured out how to circumvent the whole process so that they don't have to go for review. And that makes it even more complicated. So we need to do work at the state level. We also need to do work at the federal level. And at the end, I can talk a little bit about some of the things people can do to help with that sort of thing. Because you would think we're protected, but we're really not. So let's go to the next slide.
To go to the next one, what is going on with the old Harrison Hospital building?
That's a really good question. When these mergers first happened, and when the decision was made to go ahead and move. It was in 2017. There was a big brouhaha, and the decision was finally made to move everything over to Silverdale. And at that point in time, my understanding is that the old building was supposed to be left intact with a functioning emergency room until the second patient tower was built in Silverdale and until we in Bremerton had at least an urgent care, if not a standalone emergency room. Neither of those things has happened yet. And yet in 2021, they closed the emergency room here in Bremerton, saying at the time that they were going to have to do some staffing because they had staffing issues. They couldn't keep it open because they couldn't have employees there to work, and that it was going to be temporary. Well, that was 2021. This is 2023. It'll be 2 years the end of this month since they closed, and they have no intention of reopening. So what's
Wow.
going to happen is there was an article in the paper just this week. The hospital would the hospital system was supposed to demolish Old Harrison when all this other stuff was taken care of. And according to the article in the newspaper, they're now talking about they're going to demolish it in 2024. But it's been sitting empty for so long now that it can't be used safely. There's issues with water leaking and some other stuff, asbestos. So it's going to have to be demolished.
That's really unfortunate. Justin has a couple comments here. He says, "Thank you. I appreciate and understand the hurdles, what needs to happen for single payer, and I feel you recognize it would solve some problems in the system or outright eliminate unnecessary bureaucracy in having patient receive their health care."
Absolutely, absolutely. And Justin, I really do hope when the time comes that you drop an email to Safe Secular Healthcare Washington, which is the group that is working on that sort of thing, and I'm involved with. And we'd love to have somebody with your interest and energy involved with us in that. So, moving ahead, then, again, explaining a little bit more about the ethical and religious directives of the Catholic Church, because this becomes very serious for people like us in Kitsap County. And I believe there are 5 or 6 other counties in our state who are in the same boat that we are when it comes to having one hospital in the county, and that hospital is owned and operated by the Catholic Church. So the ethical and religious directives is a document that very carefully outlines what is and is not acceptable in terms of the kind of treatment a patient can expect to get when they are in an institution owned or operated by the Catholic Church. And anybody who is even mildly familiar with the doctrine of the church understands that a lot of reproductive healthcare services are not acceptable, that a lot of services around gender identity and gender dysphoria are not permitted, and that many end of life concerns around death with dignity or other ways that patients might opt to bring their lives to a close under certain circumstances, none of these are permissible in these directives, which were written not by physicians, but by the U.S. Conference of Catholic Bishops. All Catholic owned or operated institutions are required to adhere to these directives. And in 2018, the directives were updated. Prior to that, some people who are listening may say, yeah, but I know back in the day, there was kind of this wink, wink, nod, nod. We'll figure out how to get you the healthcare you want, even though there are these rules. And it's true. Prior to 2018, It was kind of loosey-goosey, and there were physicians and even some hospital administrators who would find workarounds for things. But that's no longer the case with the revised directives from 2018. If you read them, it becomes painfully clear that it is not permissible in any way, shape, or form to try to do an end run around these directives. And so that's when this becomes critical for those of us who need to go to the only hospital in the area and need treatment that for whatever reason they are not going to be willing to provide. So that's why this is so critical.
It's really surprising to hear that, an entity that serves the community in that way could make decisions and the government go along with it. It would seem
Yep.
like, and you're the only game in town, like, then that seems like a huge conflict of interest.
It certainly does. And it goes back, I mean, this was a long time coming. You may remember when in Washington the decision was made that pharmacists did not need to dispense a medication they thought was morally reprehensible.
Mm.
And that was sort of part of the beginning of this slide into not having that separation of church and state that we have always prided ourselves as Americans on having. And so it's really coming home to roost for us now here in Kitsap County. Whatcom County is another place that's in the same boat we are. Like I said, I think there's like 3, 4 other counties around the state who are in the same position. But it's not all bleak. So I'll tell you a little bit on the next slide about some things that are happening to try to help ameliorate some of these situations. We are very fortunate with our current state legislature. Since 2018, we've had a shift in people in the legislature recognizing some of the concerns tied to health care. Here in LD 26, Emily Randall, and in LD 23, Tara Simmons and Drew Hansen, and now, and it was Christine Rolfes until she became a commissioner in the county, all recognized that we have some issues here that the only way they're going to get fixed is to start with state legislation. So in 2021, a bill was passed called Protecting Pregnant Patients Care Act. And what that said was, it doesn't matter if a hospital is following religious directives, employees cannot be punished for providing the care that a patient needs if they do it off the grounds of that hospital or that clinic. So,
Okay.
for example, if someone wanted a tubal ligation and a physician provided that, as long as it did not take place during that physician's workday or on property owned by, say, Virginia Mason Franciscan Health, they could do that, and they could
So
not be
where would that
punished.
doctor do that?
Well, there are still some individual practices around where a doctor could
Okay.
perhaps have a relationship with that physician and be able to do something like that. Or if one of the things that was really, can a woman, oh, here's a question, can a woman have an abortion in Kitsap County? Not at St. Michael.
Wow.
They are working on situations like with ectopic pregnancies, because there have been many examples where until the mother's life was actually in danger, the woman was practically septic,
Mm.
then they would go ahead and do the procedure necessary to deal with an ectopic pregnancy, which is never viable. It's never going to turn out okay for the embryo, ever. And that still is the case a lot of times. But the only access, open access to abortion in Kitsap County is through Planned Parenthood.
Okay.
And they can't begin to handle everybody who's trying to come through.
So where
But
are women going, Susan? If it's not Planned Parenthood, are they going to Tacoma,
yep,
Seattle? Is
yep,
there
yep. Yeah, they can go to Multicare, they can go to the UW. But for a lot of people in this county, that's really a difficult thing to do. It's not an easy trek to make. If you don't have a car and you're relying on the bus system and you're in a position where you're hemorrhaging, it's unconscionable. But the Protecting Pregnant Patient Care Act does help ameliorate some of that.
gotcha.
Then the Charity Care Act was passed in 2022. St. Michael has one of the lowest rates of, or provides one of the lowest rates of charity care in the state. And the purpose of this act was to say, you know what? You can't do that. Part of the reason you're a nonprofit is because you offer charity care. And if you're not going to offer charity care, then we're not going to offer you the benefits of being nonprofit. So these are two things that were done just in an effort to try to undo some of the harm that's been done by allowing a faith-based healthcare system to come into being and monopolize our county. Let's go to the next slide, because there's some more bills that have been passed that also were designed to do this.
Okay. And Justin, I do see your question in there, and we will save it to the end.
Okay, yeah. So several more bills were passed this past year. And one of them, 1469, has to do with broadening access that residents of Washington have to reproductive health care services and gender affirming treatment in Washington. Another one, 5179, a Senate bill, actually ended up increasing access to death with dignity. Because again, here in our county, not only does St. Michael refuse to allow access to death with dignity, but 69% of the hospice care in our county is controlled by Franciscan Health. So they don't offer it either.
So what is Death with Dignity Act? Like, what does that constitute? Can you explain that a little bit?
Yeah, sure. That is an act that says when a person has a terminal diagnosis, if that person asks their physician for information about medication that they may or may not choose to take when living through whatever they're living through becomes too difficult, then they can be prescribed that medication and have it on hand. But there are a whole lot of safeguards that are built into the law. Two physicians have to agree that this is okay. Now, the term assisted suicide is really, really not the best term to use, Justin. It is a highly charged term designed to make this medical assistance in dying something other than what it actually is. Okay, it's you have to get two physicians to agree. You have to go through a psychological battery. You have to have there's a waiting period. The medication, there are restrictions on who can get the medication, how it can be gotten. The only person who can administer the medication is the patient themselves. And they can have somebody there supervising what's happening, but nobody can administer that medication other than the person who requested it. And it frequently happens, most of the time it happens, that people who ask for it do not take it.
Wow.
They just
So
want to know.
the way I'm understanding it, Susan, is let's say someone has stage 4 pancreatic cancer and they've got, a month to live, and they could, elect to have this, Death with Dignity Act versus someone who is, having a bout of depression and wants to, um, you know, do the same thing. That would kind of be the difference in that. Is that how?
Right, yeah. You're not gonna be allowed to have the medication because you're depressed.
Got you.
Yeah, yeah, yeah. And Justin, yeah, I see your comment too. It's a phrase that was coined by people who are opposed to access to medical aid in dying, and they try to make it as highly charged as they possibly can so that people get very squeamish about it. And it just evokes all kinds of visceral reactions to what's happening. But Saint Michael will not participate in that, and the hospice care that's provided by Franciscan will not either. Mike Kreidler, who is our state insurance commissioner, his twin brother Peter had terminal cancer, and when he requested information about it, because he was a patient at Saint Michael, he was denied access. There is an organization that's called End of Life Washington, and they do have volunteer physicians all around the state who will help with that process. And so people in Kitsap County who want to have access to that, that's who they need to contact. But they're a voluntary nonprofit group, and they are, again, overburdened, just as Planned Parenthood is, by filling in the gaps that are caused when you've got medical systems who won't do what they should be legally providing. And then the last thing to mention, and this hits home for Kitsap as well, and this is a bill that got a lot of support also from Tara Simmons, even though she's in the House of Representatives. She's a representative, I'm sorry, not a state senator, but it's concerning safe hospital staffing standards. Many of the hospitals now are owned by and run by venture capitalists. They do not care about healthcare. They do not care about patient care. They care about bottom line, the money they can make. And so they are staffing at levels that are not safe. There was one time recently at our hospital last summer where a nurse actually thought she might lose her license because of the staffing situation. And so this bill is going to help take care of some of that issue. So this is one approach, is working with state legislators, getting them to undo, but it's also kind of a finger in the dike approach to things. So we need to do better than that. And the next slide talks about that a little bit.
Wow, this is so illuminating.
Okay. There is a bill that has been brought to the legislature twice now. No, 3 times maybe, 2 or 3 times. And so it's going to come back again in 2024. And it's a really important one. And everybody who listens to this needs to advocate with their state legislators to let them know they want this to pass. Its generic name is the Keep Our Care Act. And what it would do would be, it would allow going forward any new proposed mergers to be under much greater oversight than they are now. It would take away those loopholes that I mentioned earlier that the systems have figured out to avoid scrutiny. A second thing that needs to happen is that certificate of need program that I mentioned also earlier on, the one that controls how many hospital beds an area can have. That program needs to be addressed, because right now it is not doing its job. It's not only not keeping up with things, Kitsap County needs more hospital beds than what are currently approved for the area. But they're not going to change that because St. Michael can't keep staff, and they can't fill all the beds they've got right now. They've got 74 beds that are just kind of in limbo. They don't even actually physically exist.
Really?
But they can't staff. They're running, I believe most recently the number was 50 beds a day sit empty in St. Michael on hospital floors because they can't staff them.
Wow.
And so the certificate of need office says, instead of saying, what's going on? Why is it you can't staff these? What's happening? Instead, they're just saying, well, obviously you don't need any more beds. You're not filling the ones you've got. So that also is something that needs to be addressed. It used to be that certificate of need was federally mandated, but it's not anymore. And 15 states actually have closed those programs. And our program here either needs to get its act together or it needs to close. One or
That's
the other.
something else. Justin is asking a question. He says, do we know what kind of profit St. Michael is making while massively underpaying and understaffing our hospitals?
Okay, that's a really tricky question to ask, Justin, because on paper they're not.
Mm.
But they have this whole system where they are putting what typical everyday people, we'd say, well, that looks like profit to me, but they put it in a different kind of place that doesn't count as being profit. So it's almost impossible to know how much they're actually making. There is a documentary that is going to be streaming the end of this month. I think it'll be available on YouTube. It's called American Hospitals Healing a Broken System. We actually had a free screening of it here in Bremerton in June. And it's on July 26th. There's going to be a screening of it online that some people might be interested in. If so, if they write to Save Secular Healthcare Washington, I can send them information about that. But it explains exactly what your question is, Justin, how it is that they circumvent reporting the profits that they're making. So
what was the name of that documentary?
American Hospitals Healing a Broken System.
That in the chat for everyone.
Great. And then let's go to the next slide.
As I'm going to the next one, Justin is asking, then how can a VC own a hospital when they only care about profit? Rhetorical question.
It's rhetorical. I think you know, Justin. So in conclusion, right now, we really are at a breaking point. Y'all know what happened with the emergency room. You know that St. Michael got a preliminary denial of accreditation last year from the Joint Commission, which is the organization that oversees hospitals and basically gives them grades. They rank them on certain criteria and say whether or not they're safe to be in. They had a huge data breach last year. They were in trouble with the agency that oversees Medicare and Medicaid, which was equivalent to the preliminary denial of accreditation. I don't want St. Michael to fail. I want St. Michael to get its act together and serve this community. I want them to stop making excuses and start doing something. And in the meantime, we as residents of the community need to understand that the current healthcare model that we're dealing with right now is simply not sustainable. These monopolies, and it's not just the faith-based ones, but any of these monopolies simply cannot be sustained. Patients need to have choice. They need to be able to decide whether they want to go to this primary care provider or that primary care provider. They need to have more than one hospital that they could actually safely get to. They need to be able to afford the health care that they're trying to access. They need to be able to access every kind of treatment that's legal in this state. And they need to know that when they go, they're going to be treated equitably. And I'm not talking simply about issues with our LGBTQ plus community, which are serious issues. They are discriminated against every day by many of these associations or these organizations. Women are discriminated against. People of color are discriminated against. People who are in poverty are discriminated against. The list goes on and on and on, and that needs to stop. And in order to make that happen, what people have to do is they have to be willing to come together, recognize the problem, understand why they've come together, and then they need to work together locally, at the state level, and at the national level in order to make something happen. If we go to the next slide, I'll give you a couple of hints about things that you can do. Okay, so
right,
you
solutions. I love
can
it.
get involved, all right?
Come on.
Save Secular Healthcare Washington is a statewide group that actually started here in Kitsap County that is looking at working with education of the public. It is looking at working with state legislators. We've been deeply involved with the last 3 legislative sessions and plan to continue that involvement. And also we have a small group that has formed here that is focused just in Kitsap County on not only saying something has to happen, but actually making something happen. And so this is a group that's really engaged, and I invite you to subscribe to that newsletter. The link is there. The email address will be on the next slide. Attend community events. We had a great turnout for the movie. We had like 50 people show up, and they hung around, some of them for 3 hours after the movie was over, just because they wanted to talk. And we are planning to have additional activities coming up in the very near future where people can get more engaged. One of the things you want to start learning about is a public hospital district. Public hospital district is a misnomer in that we're not talking about building a hospital, but what we're talking about is voting to create a special district that would allow Kitsap County to form an organization that could be used to facilitate bringing alternative healthcare back into the county. It would be a funding mechanism for that. Because right now we've got this wonderful community survey going on. Johns Hopkins is doing it. They're being very diligent. But at the end of the time, after they have said what they found and they go on their merry way, how are we going to pay for it? That's what a public hospital district could do. Not pay for a hospital, but pay to bring in some of these other primary care, OBGYN, mental health, whatever we end up deciding as a community is where we want to put our resources, we could do that. And also put pressure on the state and federal legislators to do something. And then if we go to the last slide, then folks can see the email addresses.
So as I go there, what is the position of Kids at Public Health?
Oh,
And
hey, they are working with us in partnership.
oh wow, okay,
Yeah,
excellent
yeah.
to know.
They recognize that the current situation in the county cannot continue the way it is. And I do not want to imply that they are not working with St. Michael. They are. They want St. Michael to succeed too. Anybody who is really getting deeply into this, we want to support their efforts to do better. But we also want to expand what's available. And if the only way to get comprehensive health care is to bring in some partner organizations from other places, then that's what we need to do. And I would not want for a minute I do not speak for the public health department. I would not ever want to appear that that's what I'm trying to do. They want what's best for this county. And that's what they are striving to do. So the two email addresses here, Save Secular Healthcare Washington at gmail.com, at gmail.com. That's to the group that has the newsletter, that's doing the legislative work and the education work and that sort of thing. The Alliance for Equitable Healthcare is the group focusing specifically on Kitsap County and the needs in Kitsap County. And that email address is there. If you want more information about that, you can drop an email to them. And well, actually, it's me, but I don't like to talk about myself in the third person. That seems weird. But anyway, so I invite anybody who's interested to join us. This is too important to not take action. And everybody needs healthcare. Everybody. Doesn't matter who you are, where you're from. Oh, yeah, people are definitely going to lobby against it. However, if we can't make it easy for them. Okay? If we do nothing, then they don't have to spend their time and energy lobbying against us. But if we are doing something, then they are having to pay attention to us, and they are having to try to figure out how they can satisfy us so that we're not out there constantly rattling their chain.
Well, and this is so important, you coming on and uh, going around and informing and educating the community, because many of us don't know what we're experiencing. We know we don't like it, but we
Yep.
don't know what it is, and we don't know what we can do about it. Oftentimes, we feel very powerless about that. And I've been telling, current stories about, just my own domestication and
Mhm.
experiences with healthcare, growing up, low income, and black, and my experiences through that, and what I've had to do to try to navigate it, and how it still impacts me today, even with some of my own thinking. And
Mhm.
just in that, folks see me walking around with a cane or something going on with my knee, and my white colleagues are like, oh, you should be demanding this and say, you need to get in right now and whatnot. And for me, it's like, no, I don't want to push. And they said I can't get until the 21st, and that's it. And and that's the extent of my avocation.
Mhm.
But they're like, no, you need to do this, and you need to call back and say do these things and whatnot. And so you can hear this dichotomy of just the engagement and the expectation of service just in that experience. So it's very important, and it was alarming for me
Mhm.
um, to hear the perspectives on just being having the audacity to demand healthcare. with some kind of an immediate, you know, solution, like, hey, let's start this process. You do this, you do that, or whatever the case may be. And so I'm in there and kind of fighting against that. And I'm being pulled along by folks that are saying, no, no, you need to be more of an advocate. And I'm so used to advocating for others, but horrible when it comes to advocating for myself. So it's really interesting. And so if people can live, you know, through my experiences,
Mhm.
don't do like I did. You can do this. You can say these things. You should expect this level of healthcare. You can get involved. You can advocate. There are other people that think like you. All these things are out there. I think it is so very important. I did want to go back to a question that Justin had earlier. Let me just pop up there. Let's see. I said I would ask it at the end here. He said, related to Harrison, who owns the building? He's been waiting to have it taken with eminent domain to the city of Bremerton and repurpose it for housing. First solution, fixing it is a different conversation.
Yeah, it's unfortunately, well, this is not unfortunate. The building is owned by Common Spirit, Virginia Mason Franciscan Health. They own the building. Unfortunately, it has been neglected to the point that it's not safe, and rehabbing it would be extremely difficult and expensive at this point. The level of rehabbing that would need to be done to most of it is so very expensive because of asbestos and other issues that there may be. I was talking with somebody this morning who said that they thought that there might be one newer building that's not the whole hospital, but that maybe could be salvaged, maybe. But what most of us think of as the hospital and what most of us think of as, couldn't that be alternative housing for people who are unhoused? The answer is no, because of the condition that it's now currently in. It just would not be safe anymore.
And was that by design? I mean, they own it. They didn't want to staff it. They had their plan to move to Silverdale. So you let it go for 2 years, understanding that inevitably that's going to be the outcome. It's like, well, there's nothing we can do.
I don't know. Oh yeah, there probably is Legionnaire's disease there is too. That's a water thing, and there's plenty of water issues there. I don't know that anybody there sat down and said, okay, this is one way to get out from under this. But I don't think when they closed it in July of 2021, I don't think they ever intended to reopen it. So half yes to your question.
Well, and to keep folks as informed as we can, this article was from the Kitsap Sun. This was on Friday?
Yep.
From
Yep.
Nathan Tiling. Construction on the new patient tower at St. Michael in Silverdale is set to begin in the coming months. Chad Melton, who is the president, is planning on working on a new 74-bed, 4-floor addition, which is kind of interesting if they can't even staff the 50. But okay.
Well, this article is a reprise of articles that have been published multiple times before.
Over and over again.
Okay. Very quickly, I actually intend to write a letter to the editor about it, just haven't had the time to do it yet. I hope they do these things this time. But the urgent care and standalone ER referenced in the article was originally supposed to be completed in 2018.
Oh, wow.
Okay. And then they were saying this past spring, 2023, it was supposed to be done. Now they're saying spring in 2024. Past performance has told me that may not be true. With the demolition of the building, that's kind of been in limbo. Again, it's my understanding that the building was supposed to be demolished by Virginia Mason Franciscan Health upon completion of the second patient tower, but also the the hospital was supposed to be open and functioning as an emergency room until the completion
Until.
of that tower. So, that seems to be kind of bollocksed up as well. And then the tower itself, their certificate of need says it has to be completed by December of 2025. And if it's not completed by then, that they are out of compliance with their certificate of need. This is the 74 beds I was talking about that have been in limbo.
Mm-hmm.
And so anybody who knows anything about construction of hospitals knows it's July of 2023. There is no way. They have not even broken ground. I don't know if they've got their permits. There is no way that they're going to have that building completed by 2025. And here's where the issue is with certificate of need. I don't think St. Michael is worried about it because they know that nobody is going to hold them accountable.
And who can?
Well, that's what we're trying to do. The Save Secular Healthcare Washington filed a complaint pointing out that they are out of compliance in 4 of the 5 areas that are conditions that are supposed to determine whether or not they retain their certificate of need. And we're having trouble even getting a meeting scheduled with them.
Wow. And
But
to
we're
me,
going to do it.
they have a fiduciary duty to make these services available. You were
One would
supposed to
think.
keep the hospital open while you created the other one. By not reopening the hospital, you made it to where you cannot reopen the hospital now. And yeah, this is hugely problematic. Justin asked, has anyone proposed any questions on the amount of extra causalities Kitsap County has suffered with only one hospital open?
I believe that is a question being addressed in the community survey that's being done by Johns Hopkins. But I will make sure to double check because I do have access, and I'll make sure to double check and see if in fact that question's being asked.
And I'll put
And
the link to the Kitsap Sun article in the chat there if
yeah.
anyone wants to read it.
Yeah, I don't know if that's behind the paywall or not.
Yeah,
They
that
can
may
also
be.
Google the title of it. I know that it is it's been posted on Yahoo News. So they can also access it there.
Can our city council, can our mayors do anything in the different cities?
That's part of what we're doing with the alliance is that we're engaging with city council, we're engaging and not throughout the county, different city
Yeah, whether it's
councils.
Bremerton, Poulsbo, Bainbridge Island.
Yep. And we are also engaging with county commissioners. Before he left, Commissioner Geldner convened a group that consists of a lot of different folk from around the county who are also looking at some of these issues. And the alliance is working with them. And several members of the alliance are also members of this other group. So we're really trying to come together, and we're really trying to be rational in how we approach this. And we're also really trying to move things forward more quickly than have done in the past, because I mean, we really are at a critical point.
I don't know if anyone remembers what it was like when they were seeing patients in the ambulances outside.
Yeah.
It was bad last year. I had a delay of healthcare. Matter of fact, I still haven't had a resolution to my healthcare, as I should have a CPAP machine, and that had to be put on hold, and then it got all messed up. Just super problematic for sure.
Yeah. So we need to fix it because it can't stand the way it is.
Well, Susan, I definitely appreciate you coming on and just bringing us all of this information. This is very illuminating. Please share this out. If you don't understand what's been going on, I think this really shines a light in regards to what's going on. Justin says, especially that in the next 20 years, Bremerton will gain another 20K
Oh, yeah.
residents alone. Yeah, absolutely.
Yeah.
We've
Well,
got a crisis on our hands.
and there's the whole Navy debacle as well, closing the Naval Hospital and expecting St. Michael to be able to absorb all those patients,
Yeah.
which that was not fair to St. Michael to do that. And so it only makes the situation that much worse.
And can you imagine going through another pandemic right now? With that being, what we have? I mean, that's wow.
Mhm.
And the strain on staff, right?
Oh, yeah.
That could
Oh, yeah.
wear 3 and 4 and 5 hats and burning out. Again, I've talked to a lot of former, folks that were in healthcare that said, "I just can't do it anymore."
Yeah. 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 And that is a national issue. I think it's really the pandemic really did shine a light on just how bad things have gotten. It was bad before the pandemic, but people didn't realize until everything kind of imploded.
Yeah. It's like, this was our opportunity to learn from our mistakes and make sure that if we find ourselves in a situation, we're ready to go. Yep, absolutely, Justin, our aging population also.
Yep.
Yeah, we're in a bad spot here.
Yeah, we are. We are. But I think we're also at a spot, Malcolm Gladwell calls it a tipping point,
Mhm.
where things build and build and build and build and build. And then all of a sudden, one day, boom, everything changes. And I think we're at that point where one way or another, everything's going to change.
Well, let's hope that it changes for the better, for
That's
sure.
right. Yeah.
Well, Susan, I want to thank you again for coming on and sharing this information with us. I hope that you'll come back on again in the near future and at least keep us updated in regards to what's going on. And if there's something major that's happening where we need to be activated and write a letter to this person, or hey, support SB, whatever is coming down the pipe, that we're there and ready to
Yes.
go. I would definitely appreciate it.
And that's a reason to subscribe to the Save Secular Healthcare newsletter. Every week, we include actions people can take, updates on what's going on, and articles and other things that people might want to read or
That's huge.
watch, sometimes linked to videos.
Absolutely huge. Today. Guest today, Susan Young. We will be back. I think that we have a show tomorrow evening, and then Wednesday, of course, the City Council. For Susan, I am Marwan. This is the Conduit. We'll see you next time. Bye bye, everyone.